Renfrew County and District Health Unit is located on the unceded territory of the Algonquin and Anishinaabe people. We honor the land and peoples of the Algonquin and Anishinaabe, whose ancestors have lived on this land since time in this territory since time immemorial, and whose culture and presence have nurtured and continue to nurture this land. We honor all First Nations, Inuit, and Métis peoples, their elders, their ancestors, and their valuable past and present contributions to this land. Miigwech. So the next order of business is to look at our agenda, and I will call for an agenda approval. And Jennifer is moving and Troy is seconding. All in favor? That's carried. Thank you very much. And okay, the next order is to ask if anyone has any conflict of interest with any of the items on the agenda today. None declared. None declared. Delegations, that brings us to welcoming our auditor. And then Karen will begin her process of introducing us to the audited financial statements. Thank you, Karen.
So what we have are your draft financial statements for December 31st, 2024. And we'll run through them quickly and hope that everything is good. And at the end, we'll ask for any questions. Okay, so Melissa, the next page, please. Thank you. So this is the management report signed by Heather Daly, and it's basically just setting out her responsibilities with regards to the financial statements. And the next page, please. So this is your independent auditor's report from our office to you. The most important paragraph is the second paragraph where it says, in our opinion, the accompanying financial statements present fairly in all material respects the financial position of the Renfrew County and District Health Unit as at December 31st, 2024. So it is a clean audit opinion for the health unit. So we'll continue on for one more page, please, Melissa. Great, thank you very much. Okay, so this is your statement of financial position or your balance sheet, the snapshot at time at December 31st, 2024. This is what you had compared to the prior year of 2023. So we have cash in the bank of $2.8 million. It is up $448,000 over the year before, but we will see correspondingly that our payables have gone up in the payable to the ministry area. So this is cash is made up of your operating account of $1.8 million and your reserve bank accounts. You have two of those totaling $992,000. The next line down, receivable from the Government of Canada of $156,000. This is going to be your HST rebate receivable for the last half of 2024. Receivable from the province of Ontario. So it is showing a little dash. So it is nothing this year. It has now changed down to be in a payable position at the end of the year. We'll kind of run through some more of that as we're going along. And once we get to note 2. Other receivables. So these are those small things that we've billed out at the end of the year and had not yet received the funds back by December 31st. So it's things where we bill out our time to ONA, OPSU. We did have some money owing from the Southeast Health Unit to yourselves and a few other little things like that. So $16,699 of that type of funds owing to the organization. Total financial assets equaling $2.9 million. Financial liabilities, so those things we owe. So accounts payable and accrued liabilities of $1.2 million, down from 1.5 of the year before. Now, included in this is your normal trade payables, so those things that we purchase at the end of the year that we pay for in January. OMERS that is owing for December that's paid for in January. Also our accrual for wages, salaries, benefits, and mileage type things. So in this particular year, we had 14 days. We had a full pay plus 2 days to accrue. The year before, We had 10 days of an accrual for that. So that salary accrual did go up by about $64,000 this year. Conversely, our vacation and sick leave accrual has gone down by about $57,000 compared to prior year. Now, the area of big change that really made the swing from a 1.5 to a 1.2 payable is due to the 3.5% retro pay that had been set up at December 2023. So if you recall, retro pay had been approved early in 2024, which pertained to January 1st to December 31st, 2023. That had been accrued in the 2023 records, and that was valued at $273,000 at the time. So now, going forward at the December 2024, all the retro pay has been paid. There's no accrual necessary for that. So that is the biggest chunk of your swing from 1.5 to 1.2. The next line down, payable to the province of Ontario. So now we're sitting at $497,000 owing to the province. Again, we'll go through this, but just to keep in light, there was a reconciliation for 2020, 21, and 22 years with the ministry. And subsequent to the end of the year, a big payment was made out with regards to some of that money that was owing back to them. So since year end, this number has changed drastically again because we've made a big payment back to them. Deferred revenue, $26,518. Biggest component to that is the Pembroke's January contribution is always received in December. So basically it's set up as a deferred because it's actually 2025's revenue that was received early. So we have total financial liabilities of $1.735 million, net financial assets of $1.252 million. And then we get into non-financial assets, or those things that are not cash and can't really be converted to cash. So we have tangible capital assets, which are your bricks and your mortar, your leasehold improvements, your computers, your equipment, things like that. We have a total net book value of just over $2 million of those types of assets. So this year in 2024, we did do 101,629 of additions. So we had chair purchases, air purification system purchases, about $56,000 in laptops and notebooks in there. And then kind of different this year was $20,000 of donated iPads. We had 80 iPads donated from the ministry to the health unit. So those are also included in there. And we did dispose of a few things. There were some old computers and some office furniture that were disposed of during the year. And their net book value when they were taken out was $376. So they were pretty much written off by the time they were disposed of by the organization. The next line down, prepaid expenses of $104,000. So included in that, the largest chunk is going to be insurance. So your policy runs over the year-end date. So that portion from January 1st to the end of the policy date was almost $81,000. And that is the difference basically from last year to this year. Last year, that accrual was that prepaid was $68,000, and this year it's $80,000. Included in that insurance was $9,000 with regards to cyber risk, which wasn't there before. And then the other prepaids are smaller items for postage, licensing, software, things like that go into that account. So in total, our non-financial assets equal $2.195 million, with an accumulated surplus on the year of $3.448 million. So if we can go to the next page then. Thank you, Melissa. Okay, so now we're looking at our statement of operations. So this is what we did this year. So we show budget in our first column, 2024 actuals, and then compared to the 2023 actuals. So in the grants from the province of Ontario, we're up about $158,000 over what we budgeted. Now, the ministry came out with some 3 new program funding packages that weren't available for you to budget whenever you did your budgeting. So in that, we had a seniors dental one-time of about 37,000, COVID-19 vaccine, they gave you a further 38,000, and COVID-19 enhancement, a further $67,000. So those were items that we received from the ministry, but weren't, the knowledge of them wasn't there whenever we had done our budget. Next line down, municipal contributions, exactly as we budgeted. And as we go down, then we have interest. So that first interest of 82,155, that's on your operating bank account. And then the second interest is on your 2 bank accounts that are segregated for reserve funds. So we had 50,537 from those. A little bit of user fee recovery from the Ontario Seniors Dental Program. And then other 6,600. So this particular year, we had a program called Sprite. And this was the funding through the Sprite program. And then we talked about the contributed iPads. So this is the ministry's contribution of iPads was valued at $20,000. So that was 80 iPads that were used. They were several years old. So the value coming in was $20,000 to you. Total revenue of $10,843,935, sorry. So we have our expenditures, so our mandatory programs. Now this is going to look a little different than the last several years now. So the COVID-19 coverage for both mandatory and unorganized territory, that's done. We're not doing that anymore. So now we're all rolled up into one number. So mandatory programs, we had $8.6 million of expenditures within that program. Ontario Seniors Dental, 771,000. We were actually equal to the actual budget, but there was a little bit of capital assets purchased with the senior dental program. So whenever we do our annual information return to the ministry, that capital asset will be included in the 771 to break even on the program. All right, Ontario Seniors Dental. So this was the one-time funding that came in a little bit later. We actually didn't know as the actual number that we were going to get from them until late March. So $37,462 of expenses were covered through that one-time funding. Unorganized territories remains the same as budget and the same as prior year. As we go down, the next biggest change as we're going down, Healthy Babies, Healthy Children. So this is a March year end, so it's very difficult to compare year over year and to budget because we may spend a whole bunch of money in the first 3 quarters and not so much in the last quarter of the program. So these are the expenses for that particular program from for the January through to December of 2024, but again, the program runs until March of next year. Okay, so now as we're going down, COVID-19 vaccine program, 38,176. Again, a late program usage for you. And COVID-19 enhancement, 67,300. So again, that was one of those late funding packages that we received, and we were able to cover some expenses through that. MOH compensation initiatives, 75,602. It looks like it's way up from the year before, but what has happened is in prior year, the program actually started on April 1st. So it ran April through to December. So we were missing 3 months of that program. So now this year we have a full year of the funding, plus there was a retroactive resettlement with regards to 2023, and that was a little over, well, almost $10,000 that is in that 75,000 that belongs to 2023. So it was a late renegotiation and is included in the 2024 package. Okay, so we have our RSV program, 138.8, which was exactly as we expected it to be. Merger consultant feasibility study was done this year at $63,000. And then as we come down, we have those accounting entries that are done. So we have amortization of our tangible capital assets. So those computers and leaseholds and things that we're amortizing off, $452,000. I already spoke about the little bit of a loss that we had when we wrote off some of that equipment, $376. And then the very last line, non-fundable expenses. So what this is the accrual change for your sick leave, your vacation overtime accrual. So that particular accrual is not allowed for ministry purposes until it's actually paid. So that's why it's called a non-fundable expense this year. So as we pay it, it will flow up into the mandatory program or the program that it belongs to. At that time will be funded. So the change this year, this in the accrual, was actually, it would have been a drop of $57,000. So we have an annual deficit on the program for accounting purposes of $242,662. Add that to our opening accumulated surplus to get our ending accumulated surplus, which ties into our statement of financial position, the last number on that page. Okay. So we'll continue on, Melissa, please. Statement of changes in net financial assets. So this will take your deficit of $242,000, adds back amortization, acquisition of tangible capital assets, losses, all those things that have to do with the non-financial assets we talked about earlier, to get you the increase in net financial assets of $91,000. Add that to our opening net financial to get our closing net financial. So on the very first page we looked at, we saw the assets, then we talked about the liabilities, and then the difference is called net financial assets. So this number will tie back into your first page. Okay, next page is your statement of cash flows. So because your financial statement is done on an accrual basis of accounting, what this is doing is taking it back and giving you a cash basis of accounting. So it's eliminating your payables, your receivables, things like that out of it to tie it right back into your bank account at the end of the year. So it starts off with your annual deficit, again, adds back those non-cash things, amortization, which is just an accounting journal entry, and the loss on disposal, which is an accounting journal entry. And then the next part is backing out the differences between your payables and receivables at the end of the year, opening and closing numbers. Then it takes your capital assets that you purchased of $101,000, subtracts that off because that's a cash transaction. And now we get down to the increase in our cash of $448,000. Add that to our opening cash, gets you your final ending cash on the year of $2.8 million, which again ties back into your statement of financial position that we talked about earlier. All right, Melissa. So now we have our notes to the financial statement. Notes themselves, from an accounting perspective, have not changed year over year. So basically, it's going to be just the numerical part or comparative part that we're going to focus on. So Melissa, I'll keep having you scroll down for one more page, please. We'll get to note 2. Great, right there. So this is the receivable from payable to the province of Ontario. So on the statement of financial position, when we talked earlier, we said last year we had a receivable from the ministry of $183,000. And now this year we've moved over. So now we have a payable of $497,000. So that payable $497,000 is made up of many years worth of settlements with the ministry. So they were far behind. And as I said, they've just finally reconciled during this year, late in the year, 2020, 21, and 22. So 2023 is still outstanding. They have not settled that yet. So basically, 2021, in the extraordinary COVID-19 costs, there was a payable of $654,000 plus a little bit of receivables. So the net amount owing for 2021 was $647,000. For 2022, there's a little receivable of 23,000. For 2023, there's a little payable of 12,836. And then coming out of 2024's year, we're looking for $138,280 of funding to cover programs for this year. So when we total all of those up, we get to that negative number of $497,000. Now, keep in mind, since the end of December, we have written a very large check to them. We paid them back $654,000 already. Plus, we have received and reconciled off some of the smaller amounts. So basically, from that $497,000 owing, we've already settled off 2021 and 2022. So now we have 2023 and 2024 to deal with. And in net, if we were to look at this number today, it would be about $120,000 receivable from the ministry coming into March. And there was a little more settlement done in March. Okay. So we'll go on to the next. Deferred revenue, we already spoke about this. Tangible capital assets, we've spoken about this, but this will show you the breakdown of the type of asset that we have purchased or disposed of during the year and the corresponding amortization or depreciation on those assets. So we can continue on. Okay, so note 6 is always an important note. So it starts off with invested intangible capital assets. So this is the net book value of your tangible capital assets. This is the money that you have put into buying your leaseholds, buying your equipment. So what this is the net amount. General revenue accumulated surplus is worth $363,770. It's gone up $57,675 from the year before, which is only the change in that non-fundable expense area that we talked about, that change in the overtime, sick leave, vacation accrual. So that's what it's gone up by. And the reserves have gone up to $992,906, which is the increase interest that has been accounts for those particular reserve funds. Okay, right below it, we see that continuity of reserve funds. So each one of them showing from January 1st, we had no transfers in or out, but we did have the interest adding up to come to our closing balance. Okay, and we'll go on to the next page. This shows your grants from the province of Ontario by program. And again, by budget, which was what you had set back in this late 2024, late 2023, early 2024, versus what was actually and versus the 2023 actual. So if you recall, and I'm sure you do, mitigation funding kind of got rolled up into the mandatory program, plus you got a 1% increase. So we're looking at a $6.3 million versus if we'd taken the top two numbers in 2023, which was 6.2 million. So we see that little bit of an increase happening in your mandatory program. Okay. As Ontario Seniors Dental, back a bit, thank you. Ontario Seniors Dental Care Program looks a lot different, but there was a kind of a denture program happening in 2023, which didn't happen in 2024. So that's why there's a difference there. And then as we see our COVID numbers, they're starting to go down. The expenses are going down, so our income from those are also going down. Okay, I guess that's about it. We'll go ahead. Commitments and contingencies. So these are long-term items that we have committed to at the end of the year. So basically it's our leases that we have. 3 leases, Barry's Bay, Renfrew, and Pembroke. And then we go ahead. One more page. Great, segmented information. So now what we're doing here with this particular page is this is the 2024 segmented information. So it takes your mandatory program, and we saw the total on our statement of operations, but it breaks it down now between salaries, fees and honorarium, travel, etc. across, so that we see how it was expended in which area. So for interest's sake, we won't go ahead, Melissa, but the next sheet is 2023. So we can compare 2023 to 2024. But what we'll see is salaries and benefits have gone down about 124,000 from the year before. But the big change was in that fees and honorarium, where we've dropped about $313,000 from the year before. And again, it's just the program type that's starting to change. And that's why everything is changing a little bit now. Okay. So that's about it. So I went through that very quickly. If anybody has any questions and wants to go back, just let me know. I can't see the screen, so I'm going to rely on Joanne to tell me if anybody has any questions.
I'm looking, I don't see any yet. And thank you. I must say, I really appreciated the nice organized procession through the information. I had gone through it myself, and I mostly had followed it on my own. And your presentation, Karen, helped to reaffirm some of my guesses as to what I was looking at. So that was helpful. I can, obviously we have a kind of um, complicated financial reconciliation process, so to speak, with the ministry. I'm glad that we're reconciled up to the end of 22. So hopefully this year will show us again staying caught up now going forward, which I think will be good for clarity for everybody. And I'm still not seeing any questions. So do you want to talk about your audit findings letter then and your independence letter, I guess? And if someone puts their hand up, we'll start. Oh, Neil's got his hand up. All right, come on in, Neil.
Thanks, Joanne. I thought it was a great presentation. Thanks for the great detail, Karen. My question, though, is I don't know if it's necessarily an audit question, but I noticed on the report that there was about $130,000 reported as income from interest. And I'm curious, is there any way for us to confirm, or could you propose how we might confirm that we've optimized that interest? We are doing everything possible with the funds available to us to get as much interest as possible. Is that an auditor function, or is that something I would ask the chair to go back and ask finance committee to look at?
I would suggest that go back through the chair. I can say that your group belongs with a larger group of municipalities that do work very hard to achieve a good interest rate on their banking agreements. But I would suggest that would have to go back through the chair.
So we could park that with Mike DeManoir for the resource committee, and Janet and Heather, of course, and Jason will bring information. James?
Thank you, Joanne. Just going back to the 497,000 payable to the province. I know when we were doing our budget, there was certainly some confusion over monies that were kind of on hold with the Board of Health from previous years. And that was, they were being held because of the payables back to the province. Do I have that correct, that that was part of the repayment for this 497,000?
So yes, your $497,000 payable as shown here is basically your 2020 through to 2024's accumulation of payables and receivables from the ministry. So you have now, since the end of December, paid off, I'm going to say roughly $654,000. A check was written to cover the biggest chunk out of that amount. And as of the end of March, I'm going to say that you're probably sitting at about $120,000 receivable. So you've swung the other way.
That's
you.
great. Thumbs up from James on that. And Mike, is that your hand up, I think? Yes.
Yeah, I think this relates as well to the conversation that we had in resources around Note 2. And at that time decided that we would wait till after these financial statements were presented and then try to organize a working meeting with Karen to talk about Note 2 and talk about some of the other parts of the financial statements.
Yes, thank you, Mike. And I think that's another action item for the resource committee is to re-examine the reserve like policy procedure. What should it be? Are we good? Do we put in more? All of those things, which we won't deal with here. But just so you know, Karen, we will be hoping to get you back for as a resource to help us plan and look forward in terms of being, just taking some time to look at that reserve fund policy and process.
Okay.
I don't see any other questions. Are there any other questions right now? No. So let's keep going then with the I think, and if someone thinks of a question, just pop up your hand there. I think I can see you all. Let's move on to the findings and independence letters. That's okay.
Okay. Melissa, you can put up your first letter and I'll just follow along. Okay, so we have the audit findings letter. So at the end of every audit, we send out an audit findings letter, and if there were issues, this is where we would direct them to the board. So if you were reading through your letter, you're going to see no issues. Basically, there were no difficulties, no accounting policy changes that we could see should happen, no material misstatements to be reported to you. Journal entries that we requested to be made were made by Janet, Heather, and the group. So we have no uncorrected misstatements there, no significant deficiencies in your internal controls. So everything is working as it's expected to work. So basically, it's kind of a management letter with no management letter points on it. So it's a good letter. All right, and then the second letter is the independence letter. And every year we have to, according to the rules of our association, we have to give you an independence letter saying that we are independent of your group financially. There are no family members in your group. So that's what this secondary letter is. It also sets out our fees, and although the fees may look high, they're not what drives our office, so we are not dependent upon you for that either. So that is the independence letter.
Awesome. Thank you. And again, sorry, Karen, did I just cut you off accidentally?
Nope,
No,
that's fine.
you're good. Are there any thank you. Beautifully well explained. And I took that findings letter to heart. I was reading it and I thought, oh, there is nothing to report in this one this time. And that's always a good news story for any board of directors. And thanks to the staff, basically to Janet and Heather and all the team for their excellence in terms of achieving this and bringing forward statements that were so clean, that allowed for a clean audit. And it allowed us to follow that bouncing ball with the ministry's programs and timing. Like the Healthy Babies thing, I think is always a bit of kerfuddling, different year ends, but all good. So I think and I just sort of babbled there for a couple of minutes to see if anyone else had a question. I'm not seeing any, so I'm going to call for the motion that the Board of Health accept the financial statements for the year ended December 31st, 2024, and further that the chair and vice chair sign the statements. Do I have a mover for that? And that's James and seconded by Carolyn. Thanks, Mike. You kind of tied in there, but I saw Carolyn and James first. Thank you. All in favor? And that is carried. Awesome. Thank you very much. And Karen, once again, thank you. And I'll look forward to a more detailed conversation with you and seeking your advice and thoughts on our reserve funding policy and procedure. Thank you.
Okay.
And so, with that being said, that moves us to, I'm going to call for a break when we get down to about item 8, I think. I'll keep an eye on my clock or my watch. And I thought I'd call for a break around 11, so I'll just keep an eye on how we're doing with that. So that brings us to item 7, which is the Board of Health minutes, pardon me, from Tuesday, December the 25th. And, yeah, Melissa has those up on the screen for us. And I think the main order of business here is to,
Chair,
yes, Jennifer, what's
not
that?
not December 25th.
Did I say December instead of March? I guess I had December in my brain from the audit. It was March the 25th, 2025. Thank you.
And I hope
Yeah,
we're not meeting on Christmas Day.
and I wouldn't be wearing my summer t-shirt, right? All right, minutes of March 2025, and I will ask for a mover for those minutes. Ethel moving and Jennifer seconding. All in favor? And those are carried. Thank you. Actually, you know what? We will keep going here a little bit because we're moving right along, and that's always a good thing. There is no business arising that's not already covered within the agendas. So that will let us, I think we have time for Jason then, and after his report, we'll take our break. Let's get the medical officer's health report. And I will also start by saying, and I'm sure I'm echoing what people are thinking, once again, what a great and fulsome, comprehensive report. It's lengthy, I know. At the same time, it really covers all of our mandatory and it really kind of gives us a good picture of what you've been working on this month. So let's call Jason up and see what highlights you want to bring to our attention and if there's any other questions or comments.
Thank you, Joanne. Good morning, everyone. So I wanted to start out by updating you on our response to measles locally. And overall, I've got some positive news for you on that front. You may have seen that we had 2 local cases, but I can now tell you that both have left isolation. They're no longer infectious. And as of this time, anyway, the local spread of measles has been contained, which we're very pleased with. Just to go through our response a little bit, we stood up an emergency control group. While it's just 2 cases, because measles is airborne, there's often many contacts, and so we had 38 contacts that were managed. In many cases, when indicated, we provide what we call post-exposure prophylaxis, which is often comes in the form of the MMR vaccine, which can be given after exposure and can still prevent infection. And it appears in our case that was very successful in preventing further cases, so we're happy with that. We also put forth a general immunization campaign, in particular for the most affected community that we were seeing, and it included door-to-door as well. And we were able to increase in that community the 1 to 2 dose immunization rate against measles from about 50% to 86%. And that's work is still ongoing. We still want to see it higher than that, and we're continuing that. We also saw that there was some public exposure sites, and so we did report that in a media release midway through April that you might have seen. We also had some interviews with media around regional media to explain the situation and pertinent facts about measles to the public. Overall, I'm really proud of what our team accomplished with this response, but that said, there is still a lot of measles circulating across the province. The outbreak's still ongoing. We've hit almost cumulatively 1,800 cases with this outbreak across Ontario. So unfortunately, the risk remains high that we could still see more local cases, and we're obviously monitoring that very, very closely. So go to the next section on respiratory infections more generally. There's some good news here as well. As of yesterday, all of our respiratory illness indicators are either in the moderate or low categories, which is great. Also, I just wanted to give you some interesting context on what we're seeing with COVID-19 right now. Basically, as of right now, across the province as a whole, the hospitalizations related to COVID are at the lowest level that since the summer of 2020, and the deaths due to COVID-19 that we're seeing, the rate of those deaths is the lowest since the pandemic began. So I'm really pleased to see that across the province. Moving along to our immunization programming. I wanted to give you an update on our Immunization of School Pupils Act enforcement actions. At the last board meeting that we had, we were just about to go into enforcement. And so that proceeded as planned. On March 26th, 119 students born in the 2007 and 2017 cohorts were suspended due to not meeting their requirements under that legislation. By the end of the 20-day suspension period, all but 5 of those people had met their requirements and were therefore able to return to school before the end of the period, and the majority did so quite early on in the suspension period. So that went fairly well overall. In terms of our grade 7 immunization programming, our team's busy doing their second round of immunizations across our local schools, and that includes hepatitis B, meningococcal disease, and human papillomavirus, or HPV. As of May 8th, we had done 22 clinics, and we anticipate being finished with this in early June, and completing a total of about 40 clinics across our area. And then lastly, under immunization, in our COVID-19 vaccine programming, there is a spring campaign that's ongoing from April to June this year across the province. And this is for people at higher risk of severe disease to get an additional dose of vaccine, which includes people 65 and older, as well as people living in long-term care homes and retirement homes. And as of May 9th, we had completed 4 mobile clinics at our retirement homes locally, and that work is ongoing and anticipated to be finished by early June. Next, just a couple things in our emergency preparedness and response. Our staff participated in the Frechette meetings that occur every year in the spring to monitor the spring melts and the risk of flooding alongside many partners at that table. So we did see communities along the Ottawa River that were affected by high water levels this year. And the Ministry of Natural Resources issued a flood watch for Pembroke, which was fortunately lifted last week. And as this has been occurring, we've been sharing our flood preparedness messaging and the links to our website where we have information on this from a public health standpoint, including things like protecting your well and how to address that if there's flooding. We also had 2 other emergency preparedness activities. We marked the 5-year anniversary of our local COVID-19 response and honored our staff contributions throughout the pandemic. And also from May 4th to 10th was Emergency Preparedness Week, which we used as an opportunity to share various messages through social media, including referencing our local hazard identification and risk assessment and information on our highest local risks. And moving along to our healthy environments programs and rabies control in particular. For the 3rd year in a row now, we're promoting the Yellow Ribbon campaign, which is about animal bite and rabies awareness. And it encourages pet owners, particularly dog owners, to use a yellow ribbon, collar, a scarf, and put that around their dog's neck to let people know to approach with caution, and therefore reducing the likelihood of unintended animal or unnecessary animal bites. Several veterinary clinics and pet stores across our area are promoting the campaign as well and offering yellow ribbons as well as information cards. In terms of food safety, just a general update here. A big part of our Healthy Environments team work is their regular inspections of food premises, and most important among those is the ones that we established as high risk due to sort of multiple food preparation steps as well as serving vulnerable populations. And we are on track for these inspections that must occur once every 4 months for 2025. And we're also on track for moderate risk food establishments such as fast food restaurants, which require 2 inspections per year. And then last, under healthy environments on vector-borne disease, talked a little bit about this at the beginning. So our public health inspectors are, as usual in the spring and fall, so in the spring period, actively monitoring ticks across Renfrew County and District, and we pick new locations strategically based on what we found in previous years. This year, you can see that we're going to a variety of places, including Combermere, Renfrew, Wilno area, and Chalk River, to do tick dragging and determine whether these would become new firmly established risk areas for the presence of deer ticks. And just as a reminder, the confirmed areas that we have already in our area are Arnprior, Calabogie, Cobden, and Eganville. So next to our health promotion division, we did release the Renfrew County and District Drug Strategies initial report with an opioid focus on April 10th. And we've been promoting that in the 25 priorities that are in that report in the time since on social media and through other media interviews and the like, across the 4 pillars of prevention, treatment, harm reduction, and community safety. We've also been running through the drug strategy with our partners another communication campaign called Share Your Story. That's gone quite well so far, and it's where Renfrew County and District residents have been encouraged to share their experience with recovering from a substance use disorder and the local support that they received. And we've had about 4 of them so far, and they've received really good engagement. And we're hoping that that will inspire others who are facing similar challenges and also help to reduce stigma around substance use disorders locally. Looking forward, the steering committee is going to continue meeting and receiving progress updates on the indicators that are identified in the report across each of the priorities. And they'll also be, the steering committee will also be considering other local data and how we can best evolve to not just address opioids, but other substances that are of concern in our area. And before I close the drug strategy section off, just as I've been doing regularly, I wanted to update you on our local emergency department use and suspect drug toxicity deaths. So as of in 2025, as of April 30th, there were 11 emergency department visits related to opioid overdoses. And as of May 8th, 6 suspect drug toxicity deaths. Still far too many, but this is consistent with, in terms of the deaths, what we were seeing towards the end of 2024 and lower than what had been happening earlier in 2024 and in 2023. So it does appear that all the local efforts to address this crisis have been making a difference, and we just need to keep pushing to keep making things better. A little update on our harm reduction programming, in particular for our CDHU and our outreach team. So since the beginning of 2025, our team has completed 41 visits to 13 different areas across Renfrew County and District. They've distributed 264 naloxone kits, trained 181 people, and we've had over 1,000 interactions through that team. So really happy to see that continued work, which it provides harm reduction services, sexual health testing, but it also connects them to other RCDHU services and community partners wherever that's needed. And we're continuing with our Sprite program as well in collaboration with other health units. As of April 30th, we'd done 137 tests for syphilis, HIV, and hepatitis C. And whenever somebody does test positive, we either ourselves or with partners ensure that they have treatment arranged for them. Then lastly, in this part, on an Indigenous cultural safety training, we did have 2 members of our outreach team attend the Wabano WIN, the Art of Seeing Clearly cultural safety training through the Wabano Center in Ottawa on March 21st. And this was to help foster deeper understanding of Indigenous perspectives, to show how our team members can best contribute to improving Indigenous health, and to ensure that we're creating culturally safe spaces in the programming that we're providing, as we go about. And this was, for our outreach team members, very well received, and they're going to be applying that in their practice moving forward. And just also wanted to mention that this was organized for the Ottawa West Four Rivers Ontario Health Team. So really happy with that work that they're doing and that collaboration. And then lastly, I wanted to give you a little update on some work by our community dietitian who provided an educational seminar to our childcare providers throughout Renfrew County. And this was on how they can practically apply Canada's Food Guide to ensure they're meeting the nutritional requirements for the kids under their care. The guide was recently updated in 2024, and so there's a lot of new stuff in there. It helps to take sort of the very high level stuff from the Canada Food Guide and put that into the day-to-day. And we're planning to offer that biannually in the evenings so that we can accommodate the schedules of childcare staff. and really happy with that collaboration with Renfrew County. So with that, I'll hand it back to you, Joanne, and
Thank you.
happy to answer any questions.
That's awesome. Thank you. And I'm sure everybody was equally noticed to the reduction in deaths, as you say, not where we totally want to be yet, but certainly going in the right direction. And I can't help but believe that the health unit involvement, I do see you, Jennifer, Carolyn, and James also has been a key indicator there. And then I also wanted to just check with you when you said that any people under Sprite, folks who are testing positive who do not have a family doctor, they're like for sure they're getting the treatment intervention somehow. Like you're able to make that happen.
Of course, yeah. We have a network of partners that can provide treatment, but then we can also provide treatment if needed. So
Okay, that's awesome. Those were my two main points. And then I think, let's see, who was first? Jennifer, were you up first? I think you were, and then I might have been Carolyn and James. Thank you. I had my eyes off the screen for a second there. Jennifer.
Thanks, Chair. Again, Jason, what have you been doing all these months? So much information. I don't even know where to start. Thank you, thank you, thank you. Everything in your report this month was so important. I think the measles, it's amazing to me once again that we're even using the word measles in 2025. I did watch a very interesting segment with Dr. Isaac Bogosh this morning about the caseload in southwestern Ontario throughout the Mennonite community, which is so sad. So I hope that they're getting the help that they need the way our health unit is taking care of our population. But the other thing that I must commend you on, I've preached this over eating disorders and everything else, peer-led anything or peer-involved anything, especially when it comes to substance abuse, is so important. I cannot stress the importance enough, and I just want to thank you for recognizing that somebody's personal story could help more than any I don't know what the AA for narcotics is. It NA? Okay. Any of those self-help groups, I think being out, even with our MESA team, our community paramedics, and being able to talk the talk and not just walk the walk is so very, very, very important. Just wanted to congratulate you on that. Thank you.
thanks, Jennifer. Yeah, our communications working group with the drug strategy is really dynamic, energetic team, and they've done great work with that campaign.
Awesome. Carolyn.
Thanks. Jason, I didn't quite understand the yellow ribbon on the dogs thing. Does that mean that the dog has been vaccinated and he's a safe animal? I didn't quite follow it. Could you explain that again,
Sorry,
please?
I moved through that pretty quickly. Yeah, it's no, the yellow ribbons there for anybody for whatever reason to just indicate if people should actually approach their pet with caution. It's got nothing to do with vaccination.
Okay.
In Ontario, all dogs are supposed to be vaccinated against rabies, so this is really just about reducing those animal bite encounters whenever we can. So this could be because the dog is anxious, they've just had an operation, so they're in pain, something like that. Just again as a flag to advise people to approach them with caution, because often if we can't locate the dog that was involved in a biting incident, then the person may have to go through a lengthy process with 4 different vaccines spread over 2 weeks, and so engagement with the health unit and healthcare providers. So we're trying to prevent bites whenever we can. So
Okay, thank you. That makes sense to me now.
yeah, no problem.
Awesome. And then James and then Heather.
Thank you, Chair, and through you to Dr. Morgenstern. Just want to thank you for a fantastic report. The detail is really, really appreciated. And I do want to start by first commending you on the collaboration that you've certainly taken the lead on with all of the other organizations in Renfrew County that are responsible for battling the drug crisis, the encampments, etc. And even we had the presentation at County Council at our last meeting from the Ottawa Valley Health team, and they're certainly very involved as well in all of the partnerships with the different organizations. So that's great news. I just had a question regarding there's 5 students that were not immunized from your report. Any movement there, or are there still those 5 outstanding? And you had mentioned just before we got started about a possible vaccine for Lyme. How far out are we from seeing that, or do you have any idea? Thank you.
Sure. So in terms of those, first of all, thank you, James. Appreciate your comments. In terms of the 5 students, as of the last reports I received, no, I don't believe there's been any movement on this. Generally, our approach to this is we want to be balanced in our approach. So while we could institute another suspension period, we don't do that within the same school year. So again, next year we'll go through the same process. And if they're not up to date by then, we will, it'll be the same thing that happens, unfortunately. We don't just sit there though and wait for them to come to us. We very actively try to reach out to these individuals and offer every opportunity to help them get vaccinated. If families wish, in some cases, we will even go to their house and vaccinate them. So, we do try to do everything we can to reduce those barriers. We do what we can with that. In terms of the vaccine against Lyme disease, yes, there is some very promising work going on there. There's no guarantees at this point, but it's currently in phase 3 trials. And so there's a very promising candidate in phase 3 trials. It could be submitted to Health Canada for approval as early as 2026. So that's sort of the timeline that we're looking at. And it would be great to have that tool, given the spread of tick-borne diseases. So.
For sure. Thank you. And Heather Czar.
I too was going to ask about the 5 that were not immunized yet. And you answered that question quite well. Thank you for that. But I also did want to, again, as everybody else has voiced, the great work that the drug strategy is doing. I truly believe it's humanized the issue for many people, decreased the stigma of this group of individuals that are trying to do the best they can in their lives. And I appreciate the fact too that it's been publicized so much, and it's out there for everybody to see and to perhaps help in any way they can, whether it's at the grind or on a committee or whatever. So I thank you very much for that work.
Thank you, Heather.
Awesome.
If I may.
And Jennifer, you have another comment or question?
I just want to be cheeky here for a moment. I do find it odd that we were through the Frechette with no flooding worries, because I'm not the warden this year as I was in 17 and 19 for those horrific floods. But then I was acting warden at the beginning of the month, and then there were concerns about the audit. So I'm not saying it was me, but I'm a little concerned it was me.
In being cheeky back at you, does that mean that you have to question whether you should try to be warden again?
It's crossed my mind, Joanne. It's crossed my mind.
I'm sure it's just a coincidence, Jennifer. That's bizarre, though. So there being no other questions for Dr. Morgenstern, could I call for a motion to approve his report? Mike DeManoir, and seconded by Heather. All in favor? And that is carried. Thank you. Okay, my watch says 11:07. Let's take that 7-minute break and come back at 11:14. We'll have thank you. All right, I think looks like we're pretty much all back. So I think we will resume. Yes, there's Aaron. Hi, Aaron. I think we're all back. I'm sure Melissa's back. So I think that brings us to, on our agenda, we're at item 8, staff reports. We've had 8A, and now we're moving into 8B, which will be the CEO report to the board. And we're going to call up Heather for that. Thank you, Heather. Heather Daly, thank you.
Great, thanks, Joanne. Okay, so I think this report flows nicely from Karen's presentation this morning of the financial statements and the financial information. So at the end of March, which is the ministry's fiscal year end, they sent our final agreement for 2024. And this was the formal approval for additional one-time funding amounts, which have been applied for in 2024, but not confirmed. So the amounts were consistent with our expectations and no unpleasant surprises. For the Ontario Seniors Dental Care Program, an additional $52,900 was announced to help reduce waiting lists consistent with prior years. The MOH top-up was confirmed for 2024, and the PHI student placement funding, also consistent with prior years, was confirmed. COVID-19 and RSV funding were also approved, and unspent amounts were carried forward to March 31st of 2025. Subsequent to that, we also received the information about our 2025 funding letter, and that confirms the 1% increase to the mandatory program base as promised by the ministry. May has also been the Alpha Workplace Wellness Month, and the focus is on all things wellness, physical, mental well-being, and social health. So there are some pictures attached to the report showing some of the activities held so far this month. And Alpha has shared our pictures with other health units by email, and they're also planning to share them at the conference. So it's a great job by all the RCDHU staff organizing this and participating in it. And that is my report.
Thank you. I love looking at the pictures. I was like, how can we as board members contribute at some point? I want, it would be fun to have something that the board was, I don't even know what right now, but if that would be fun. We could also show support for Health and Wellness Month somehow. And I'm very proud of you folks that you're sharing the pictures with Alpha, for Alpha. Yeah. Sorry, Heather, I cut you off.
I was just going to say, well, maybe you can, I don't know, take a moment today at the meeting. I don't know, or we'll plan that for next year for the May board meeting, maybe something. I don't know.
That'd be fun.
It's a
Maybe
great
by
thought.
next year. Yeah, if we were meeting in person, we could go for a quick walk, or what's pause with Patty? I'm like, what's pause with Patty?
It's most excellent. Ask Patty. She'll fill you in.
And sure, I would love to hear Patty. What's pause with Patty?
So Pause with Patty, we gave it a name this year. We did this last year and we continued this year. This is mindfulness moments that I facilitate, and we've landed this year doing it more in the morning time, and so it sort of varies between guided visualizations, a few tutorials on breathing, Nadi Shodhana or altered nostril breathing, box breathing. These are all key tools that keep us grounded. So, and we think we'll continue Pause with Patty. And Pause with Patty, for those that are not, and it's a virtual attendance. And then afterwards, with the help of our communications, they're taped and then available to staff for ongoing, or if they weren't able to attend that day, and to do it in a time that works for them.
Nice. Well, I've certainly been reading a lot about the importance of mindfulness and breathing and meditation, and in terms of brain waves and general, like not just brain health, but overall health. So that's awesome. And I think did someone have their hand up for Heather with a question for Heather that I somehow missed? No? Okay. Did I have another question for Heather? Just trying to think. No, I think that was the main thing this time. Thank you. I know you've been very busy, even though it's not all in here. I know you've been busy, and I appreciate that. So I think we could if there are no questions, I'm looking one more time. Then we could call for the resolution to approve the report, that the Board of Health accept the report to the board from Heather Daly, Chief Executive Officer. And that's Troy is moving, and it's seconded by Jennifer. Thank you very much. All in favor? And that is carried. That's awesome. Thank you. So that brings us to item 9, which is our board committee reports. And this month we have the report from governance. I'm going to call on Troy. Thank you, Troy.
Thanks, Joanne. Good morning, everyone. So I have the pleasure in terms of reporting on the governance committee meeting that was held on Tuesday, May the 20th. We continued our review and revision of the procedural bylaw. Lots of great input from the committee members in terms of, addressing and updating our procedural bylaw. As you're well aware, we're supposed to do that every 2 years. And so we're on track, and we've scheduled another meeting to continue that review on July the 8th of 2025. We also did a review of the action list, which there was no open items directed for the governance committee. So short and sweet, and back to you, Joanne.
Awesome. If there are there any, I'm just looking to see if there are any questions. No questions at this time. So we'll call for a motion to accept, hang on, look at my motion. Be it resolved that the Board of Health accept the Governance Committee report, May 2025. And that's Carolyn is moving, seconded by James. All in favor? And that's carried. Thank you. Thank you very much. All right, so correspondence. Now, we have the, well, that's new business. We have the alpha resolutions, which I have here in front of me. I thought there was also correspondence, but maybe I'm wrong. I know we had the alpha info break for correspondence because I remember reading through that. Was there any other correspondence that we need to discuss? I'll ask Jason and Heather to remind me if I'm missing something else in the correspondence here.
Sure, there's three that I can speak to briefly. So the first is a resolution from Public Health Sudbury and Districts about support for a provincial immunization registry. Just a tiny bit of background on this. We do have a system called Panorama where we record as a public health unit everybody's vaccinations. Obviously, we have to monitor that for our Immunization of School Pupils Act enforcement, but our records are definitely the best for our school-age population. For adults, it's not as unified, and it'll generally be just held by the healthcare provider that they see regularly. And for a family doctor, it's not accessible to use the current system. That also can present issues during our enforcement of the Immunization of School Pupils Act, because sometimes students do have up-to-date vaccines, but we just do not have the records yet from their healthcare provider. So again, this would definitely be helpful to have a more streamlined provincial immunization registry. It's been called for a long time. It's just been a challenge, I guess, for the province to stand up. The other resolution is also from Public Health Sudbury and Districts. It's about their endorsement of the Walport report, which is an independent report relating to COVID-19 and our pandemic preparedness at the federal level. And it made a number of different recommendations that they're asking that we consider. A lot of them around our surveillance and data systems, having improved science advisory mechanisms, improved pandemic preparedness research and funding, those sorts of things, as well as a national risk register related to pandemic preparedness. They also mentioned the Chief MOH's report that we've talked about previously that came out in 2023 on ensuring our preparedness for pandemics. And one of the things that he talked about there, which they note hasn't been followed through on, was a sort of a yearly report to government on a number of different preparedness indicators against the pandemic. So again, like these reports are important. I think they have some really valuable insights and ways that we could remain prepared for for future pandemics. And then the last is some good local news for our healthcare sector more generally about the expanded emergency department at the St. Francis Memorial Hospital. So really happy to see that.
And I saw Jennifer's hand go up. Sure, Jennifer, thank you.
What I'm hearing, Jason, is you would like us to endorse those two resolutions as our CDHU.
Those letters.
Right, yeah, if the board's supportive of it, I think that it's aligned with our CDHU's positioning too. So yeah.
I agree. So I'd be willing to put that motion on the floor.
Thank you, Jennifer. I know I was wondering the same thing and I wondered about staff's time, but it sounds like Jason's in support and James is agreeing. Now, is that something that we have to make a motion or is it enough to indicate that we support? Jennifer saying make a motion.
Absolutely. A
I know
motion. It's in the minutes.
it's in the minutes. I know I hate motions from them. Yeah.
When we go back, when somebody goes back 5 years from now, it's right there.
And says, why did you send that letter or something? Sure, I get that. And then Neil, should I let you speak first? Because is it related or something different?
It's related, but probably better to get the motion on the floor if you want to recognize the seconder, I think.
Okay, so Jennifer's making a motion that and James is seconding, is what I saw. And the motion would be it resolved that the Renfrew County District Health Unit senior management, senior leadership also craft a letter with the board. Who should, wait, I got to look at their letter again. Is that supposed to be signed by the board chair? Is that what we do? Probably. That a letter be drafted. Yeah. Okay. That a letter be drafted to be sent by the chair to support these two letters from Sudbury. Because I agree with you, Jennifer. They're both really important. We've heard the importance before about the immunization record system. And I know as an individual, I want to be able to do that. Like, I don't always remember. And what if I got the vaccination over here and my doctor doesn't know and nobody knows, and maybe I just have to get it again. And that seems like a waste of resources. So anyways, does anyone need to amend that or is that satisfactory? And if it is satisfactory, we've got a mover, a seconder, and a motion. Or is there any discussion or questions? Is that where you wanted to say something, Neil?
I can do it now, Joanne, or I can wait until after the resolution goes. I'm in support of the resolution.
Okay, so let's call the question then. All in favor of correspondence being sent on these matters, these two, thank you. That's carried. And then Neil.
Good. So back to Dr. Morgenstern. The 2 points that you raised, and I love the fact that we just finished the resolution. When it comes to having the records, the immunization records on file, and there's this regional discussion right now about using Epic right now, and they're planning to use it at the hospital level. There's discussion being examined for primary care access to it. Is there a way for us to put it all together that public health can also access Epic for these kinds of things, at least regionally, to share? So if I log onto my chart, I can see my immunization status.
I certainly think that's something that could be looked into. It'd be most powerful if it was coming from the province, is this total unified approach. We do have a system called Clinical Connect that we can use that does feed from a number of different record systems, including Epic, certain important information related to public health follow-up, but immunizations aren't really part of the scope of that. So I think that is a powerful system, certainly something that could be looked at. Also to give the province and the chief MOH and their office, they're due. They have launched a process to review our whole public health IT system. It's very complicated with a lot of different pieces of software, some of which are over 20 years old, and how we can best unify that under one umbrella. And so I think that this registry would be part of that and really a cornerstone of it. So I don't know if that helped.
Yes, Neil, follow up.
Thank you, Chair, and that's perfect. I love the approach, and I just wanted to plant the seed. My second comment is related to your second item of correspondence when we spoke to declaring some kind of dashboard for pandemic or emergency responsiveness. And I believe you're referring at least at the provincial level, if not the federal level. Is there a requirement, or is there something we can consider implementing regionally? Should the board be getting a similar report for a regional readiness in that manner?
That's something that we could certainly look at. Throughout my MOH reports, I try to touch on elements of different indicators, but we could look at standardizing that more and having a full list of indicators. The emergency management and preparedness protocol from the province was recently updated, and it does have a number of indicators in there that we report up to the province. And certainly I can make sure that we highlight those to you as well. And what I was referencing in particular was to the provincial, to the provincial parliament. Basically, what the chief MOH recommended in his report was a yearly report on the whole public health system's preparedness, which I think would be based on those indicators that we report up to them. So anyway, but they're both related.
Awesome. I'm just looking to see if there's any other, I don't see any other hands up right now. So I'm going to move, there are no, item 11, procedural bylaws. There are no bylaws coming forward at this time. Under new business, we are moving to the alpha resolutions for consideration. And I'll remind everybody that because of the size of our population, we're entitled to 4 votes at the annual general meeting. And those who are allowed to vote are members of the board or the medical officer of health or assistant. And so we will have those 4 votes. We have 4 people going. We have our vice chair, MOH, and CEO are going. So between us, we'll figure out who's holding the voting cards or whatever. I was kind of already thinking, well, we'll give Jason 2 and Ethel and I can each have 1. But in any event, you folks directed our voting decision making last year, and as I'll ask you again, there are two resolutions being brought forward. One from Simcoe around integrating the Ontario Early Adversity and Resilience Framework, which is relatively new. I think it came from Fraser Health at 22 or something like that, to improve population health outcomes, which is great. We've been talking about children a couple of times today, and so I think this is probably relevant. And then the second one is a resolution, from the Board of Health for Public Health Sudbury and districts, that the province enshrine Indigenous representation on boards of health. So I'll just throw it open to the floor to see if anyone has any strong opinions that we not support these, or questions about any of them. And Heather's are, yes.
Could you explain the first resolution and what that program entails, please?
The Ontario Early Adversity and Resilience Framework. Now, Jason, did you want to start on that? Like, I know I read through the information, but you probably know more about it than I do.
Sure, yeah, I don't mind speaking a little bit to it. So it's all about ACEs, which are adverse childhood experiences, and what we've found over time that are linked to the more of these that you have as a child, the more likely you are to have a number of negative health outcomes related to mental health, chronic disease. It's very wide spanning. Their negative impacts, substance use is a higher risk, all of these types of things. So what this framework is putting forward is a systematic way of looking at and addressing that. And it can't just be done by public health units because it's sort of society-wide. So it talks about collaboration. There are 4 main areas of sort of implementation strategies, which I think is the most important. It's around policy development, so particularly looking at family stability, economic security, access to education and healthcare. There's a piece on community engagement, piece on capacity building so that professionals have all the resources they need to best respond to trauma and adversity, and then also improving our monitoring and evaluation of a number of different ACEs indicators. So I think it's consistent with our overall posture at RCDHU, and certainly something that we want to work as effectively on as possible. It relates a lot to the prevention pillar of the drug strategy as well. So there is certainly work happening in this space, but there's always room to improve and to be more deliberate and well-defined in terms of our work in that area.
And if the province adopts this as an approach, there may be funding to help further the work. I know I was thinking about nutrition and access to food, healthy food, and how important that is, and how I shouldn't say disorganized in our district, but certainly not apparently organized in any kind of unified way, like a council for food security or whatever it might be called. And what was the other one I was thinking about? Well, the work that you'd be doing with the early, like the daycares, for instance, with the childcare in terms of nutrition. I thought that was like, I could see where different pieces would link. Immunization, like a lot of pieces could feed into that notion of the healthiest possible early years.
Yes,
Neil,
our
did
Healthy
you-
Babies,
yes.
Healthy Children program. Sorry, that is another major way that we directly sort of work in this area.
And you work in that area. Sorry. And then I didn't mean to babble on, but I was thinking, I thought I saw a hand again, but then maybe someone put their hand up and took it down. Was that you, Neil? Did you have your hand up, or Jennifer? Someone over there on that side of my screen.
It was just the thumbs up as Jason was talking.
Oh, okay, the thumbs up. Thank you. So, and then Heather did that.
Yes, thank you very much for that. It does follow the same themes as a drug strategy in many ways, doesn't it? That holistic kind of strategy. Thank you.
I know it was quite a detailed description of this in here, although I did read it, it was hard to just remember it all in the moment. So thank you, Jason. I know there's lots of great attachments there. So are there any other comments about the resolutions? And Ethel? You might have muted again by accident. Could you unmute? Oh, there you go. Start again, please.
Sorry, I'm assuming from the board that you are in favor of the two resolutions? We're just talking about the first one.
There was a question about one, but I haven't heard any disagreement with either one of them yet. So maybe, I think maybe we just have a motion. Does our board agree to vote in favor of these two resolutions? And Heather, yes, you're moving that. Yes, and seconded by Jennifer. Thank you. All in favor? Thank you. That's excellent. And that brings us to the action review list. The Kids Come First presentation is still pending. And when the stakeholder committee and the planning for the board retreat take place, it's possible that that group might recommend that happen at the board retreat. And if not, if we think other matters have a higher up on the list of priorities, then subsequently we'll plan that date for the Kids Come First presentation. And I think with a lot of the conversations we're having about children and child health and the importance in the long run and connections to these other important matters, that's going to be of more interest as we see the connections. And then the database for future delegations, the Stakeholder Relations Committee also has that on their action list. So that's pending. And I think a meeting date has been selected for that. So we'll learn more about that. Probably it'll be a verbal report because I think that committee meeting is very close to our next board meeting, but something is definitely working on that. And the same with MESA and the Heart Hub presentations, which again, I don't know whether or not there's a plan to bring that to the June board meeting or whether it's felt that should be at the retreat. And that I don't know for sure the answer to. When we asked the that they be invited to the June meeting. We were also aware that that might or might not be timely in their as they're unfolding their work. It might be too soon, but so I'm going to leave that to see if that's the right time or if we're going to bring that. It's on the list to do. Then maybe if there's something, if you need to interrupt me there, Jason or Heather, just put your hand up and I'll stop and bring you in for any further updates on those matters. And then the board planning retreat. As you know, we're planning to have an in-person board retreat for our October board meeting. And the location and content, although I think the overall theme is definitely going to show us a focus on partner collaboration with a perspective on advancing excellence in achieving our public health goals. So that's all pending. And then the meeting with the member of parliament was added for an introductory meeting. And in that regard, what I wondered, does the board think that it would be a good idea to invite Billy to our June board meeting, where we will have an in-person board meeting with a staff meet and greet to follow? Should we invite him to come in near the end of that meeting and then have a bit of a, at the board introduction go around and then maybe the informal meet and greet time? What do folks think?
Chair, I will caution that they are still sitting in June. You might have to wait till they're on a break to have Billy come in person.
Okay. Do you think
Can't
they'll be
hurt to
sitting?
invite him.
But
You
do
can
you think
certainly
that?
try.
Sure, we could try. Do you think they'll be sitting at the end? Like our next meeting is June the 20. I'm thinking it's the 25th or something.
The only thing is that they started late. And that's
Oh,
why I'm wondering.
I don't know. I think they'd be
okay. Right. So
I
if
can text Billy now and ask him when they stop sitting.
Yeah.
sure, and because you're chairing stakeholders, that meeting's not happening until just before that meeting. Sorry, I'm thinking out loud. We could find out if they're sitting, and as Carolyn says, if you guys are in agreement, if you folks are in agreement, we could certainly invite him. If he can't come, he can't come. We could try to have him come at his next earliest convenience, or maybe to the board retreat if they're not sitting then at the end of October. And irrespective of that, if he's not available to come to us, then we can try to find out when it would be convenient to go and meet with him. I think it would be ideal to bring forward our paper that the health unit prepared, or business case might be too strong, but it was definitely an introduction to a business case that was prepared at the end of December, beginning of January. And just to start again with introducing ourselves and our priorities and our successes and our challenges.
Okay, I just shot him a text.
To find out their schedule, that's great.
Yeah.
And although this isn't, and I don't know sometimes where to put stuff, I noticed something I was looking at, maybe it was on Facebook or something, I'm not even sure where, LinkedIn maybe. So it wasn't Facebook, I don't go on Facebook. It was something about AMO. And if you want to do a delegation to AMO in August, I think it is, you have to make the request by May the 30th.
Yeah, this Friday.
And I wondered, are there delegations from our municipal reps on our board going forward? Should we be trying to chime in on something? Should we be trying to have something ourselves? Like, just not sure what people's thoughts are. Or anybody.
Well, the county is making delegation requests. You have to remember that they're kind of quickies, right? You're not there for more than 10 minutes, and 5 minutes of it is introductions. I think that a meeting with our MPP and then going from there is probably our best MO for our CDHU, but I will leave that up to my colleagues to see what they have to. Oh, Ethel's got a thought.
Sure, Ethel, chime in, please.
I agree with you, Joanne. I got a meeting last year, only because I didn't get one as a delegation, only because I spoke to the minister after a breakfast. So it's quick, it's easy. You come in, but it takes 5 minutes for everybody to introduce themselves. You have about 5 minutes to do your presentation, 7 at the most. Then they want a picture op, and then you're out because they have all kinds of delegations coming in and out. So I think last year was at Troy, we tried to piggyback onto something, and it really didn't work out very well. But so I just want to say, like, if I'm at a delegation and get one, and you want me to say something, that's not a problem. But just so you know that it's a very, very tight time allotment that you get.
So maybe it's just as effective, so to speak, to once again, maybe look at our, I'm going to call it our position paper. It's not really the right term, but for the moment, to look at that paper to see if it needs to be updated at all from January with any sort of bring it more current. I think we've got a lot of success things to, I mean, look at the success with the school immunization alone. And Neil, I do see your hand up, so I'll stop and bring you in.
I was just going to add to both the comments made by Ethel and Jen. I know that the county has generated like a 3-page advocacy list of issues that they hope to be able to advocate to the province. AMO delegations may encompass a portion of them, depending on time and the issue. I expect that Pembroke would have a similar advocacy list, and so would South Algonquin. And those being the 3 organizations that the health unit represents. Maybe we could ask staff to coordinate with the CAOs, get access to these 3 lists, see where we may have input, if we have input on any of them, and use that as a starting point. Maybe it's we just add a speaking point. Maybe it's so important in the future we might consider attending, but at least we'd be aware where we could unify and echo the points or support each other on the points.
That's a great suggestion. I really like that because I don't think it's necessarily a good use of resources to attend if we're not really sure what we're doing and if we don't think we're going to have enough time to have the impact that we want. And collaborating with our municipal and county partners totally makes sense to me for making sure our message that is unified, because the more they hear the same thing from all of us, perhaps they'll listen. Like, you know, my broken record about the rurality and the relatively low funded Crown properties, that the funding hasn't changed forever. Like, I know we're still in the corner of the, you know, we're still kind of on the seat in the corner of the room because we didn't do what they wanted us to do when we wanted to do it. And sooner or later, we should still be able to make our points and advocate for proper funding. I mean, the 1% is just not fair in my mind. All right, so Jennifer, yes.
So Billy just texted me, yes, just reach out to his office and they'll check scheduling. And if there's a problem, he said we could always do a meeting at his office.
All right, so I'll leave that with staff so we can add that to the action list to just reach out and try to coordinate scheduling and see if first and foremost he could come to a meeting, and if to us, and if not, we'll see. I know with the last time we met, we were limited by the MPPs setting a maximum number of people. So it's also been said to me that it would be great if we could have at least another board member to go with. So we'll try to at least have chair and vice chair at the very least.
But
and
let's remember, this is a new MPP, so let's set expectation as well.
Sure.
And he is very eager to get involved, and he should be paying attention at Queen's Park, but he's texting me. I'm just saying. I'm kidding. I think they're at lunch, but yeah, I think if staff wouldn't mind, and whomever is going to do that, if there's a challenge, just let me know, and I'll shake a tree.
Thanks. And Neil, you got your hand up again?
It was not related to this point, but another point on your list. Do
Okay,
we
well, I
have
think
a,
yeah,
do we have
can
a
we
date
finish?
for that? No, I've lost the name, the
The
seminar, the
the
retreat.
retreat, that will be the regularly scheduled October meeting, which would be the last Tuesday, is what I'm thinking. And I'm thinking the stakeholder committee is going to talk about possible locations. And I have a secret hope that at that point, with our representation on that committee, someone will have some ideas about a really great and hopefully free space in which to do that, or at least affordable. And I'm sure the staff have already got ideas, and the stakeholder committee members have probably already got ideas.
We should book the whole day.
Yes,
Okay, good. Thank you.
I think so, or at least a 6 to 7 hour day. We'll have food, and Ethel has also offered to open the meeting, which would be amazing. She's also offered to open our June in-person meeting, so we'll have that benefit of that also, which will be great.
But
Did someone
Chair,
else?
I would like to put out to the board that the chair of stakeholders has no great ideas. If you have great ideas, just email them to me. Neil, tomorrow you can just wheel over and punch me. Just let me know anything you want. Let me know what you want to do.
That'd be great.
No great ideas.
Good. So I think that takes care of the action list. Have I missed anything? I'm looking at Heather, Jason, looking at everybody on the board. Oh, okay. So that brings us, okay, where that brings us is that our next order of business is that we will be moving into closed, as you know. And so Melissa will put us into groups, or, put us into a private room. And so I'll ask for a motion to move into closed. And that's Ethel, seconded by Troy. All in favor? And that's carried. Thank you, everyone. So we'll proceed into the breakout rooms, I guess. The June meeting is June the 24th. It's in person. It will be followed by, followed by a lunch and staff meet and greet, which I really appreciated last year. So I hope that we can all be there for that again. And at that time, we'll figure out what our summer meeting schedule is going to be, because we probably need at least one meeting in the summer. Just partly why I'm saying that is because I know the work of the governance committee, we're really getting somewhere with the bylaw, and there may be some things we need to bring back, and there may be other deadlines that staff that need us to meet in the summer. But the thing that I really wanted to talk about was that the September 30th meeting, which would normally be a meeting, is the day of the National Day of the Truth and Reconciliation, and the health unit will be closed for that day as a stat. So I'm going to propose, well, I had two thoughts about that. One, I wanted to check with staff if we absolutely have to have a September meeting. I suspect we do, just because of ministry reports and things that go in the fall, and wanting to stay on track with our financial reporting. So I was thinking that we would move the September meeting to the week before, which would be September the 23rd. And I especially wanted to talk about this today so that people who have a lot of other things going on in their calendar would have a chance to see that the 30th is being released. And I'm asking that we look at the 23rd.
I'm good with that.
Good? Okay, good. And Jennifer, Melissa, can you see if you can unmute me or turn my camera on? And if not, you may have to do what they wanted me to do, which was shut down or exit and come back in, Jennifer. And I didn't want to do that at the beginning of the meeting, but it might have solved my problem. I'm glad I'm not the only one who can't get their microphone to work. I don't feel so alone now with my problems. So if that's okay, that's the date of the next meeting, but Jennifer might want to say something. So actually chat if you do have some.
Sorry, Jennifer, I cannot unmute you.
So the proposed date in September will be September the 23rd, the Tuesday, the penultimate Tuesday versus the last Tuesday. I'm just looking to see if I missed any other.
I'm not available that day.
Heather's not available that day.
Jennifer's not available that day.
She says
Jennifer's-
carry on.
Oh, well, we may, I might need you to do, Melissa, is actually send out a poll, because we definitely want to make sure we've got quorum. So we're 2 down, which, okay, we could still have quorum if everybody else can make it. But and I'll also ask Heather and Jason to look at the schedule of things. And maybe we'll chat after this meeting when we'll have a follow-up meeting after we exit this meeting with Heather and Ethel. I'm hoping that you'll be able to rejoin that, and we'll just take a quick look at the action list and have a quick chat about options for September, and just to see what other ideas there are. I'd hate us to have to move it to a different day of the week. Moving it earlier in September would probably be even harder for the staff. So I'm just not sure right now. We've just got to stop, and we've got to make sure we have quorum. That's the main thing. What are you thinking, Carolyn?
Oh, I'm good with the 23rd, but yeah, sure. Send out a monkey poll.
And
Whatever.
make sure we've got quorum. Okay, so I think that concludes our business, and we could have a motion to adjourn. Carolyn is moving and Troy is seconding. All in favor? And that is carried. Thank you all. I think that was a great meeting. Thank you very much. So we're going to sign off. We'll see you all in person in a month, which will be wonderful. And watch your email, Ethel, and I will also for a message from Melissa to join a subsequent meeting where we'll do a quick review of the action list and see if there's any other thoughts about meeting dates. And we'll let the rest of you know. Thanks. Bye, everybody.